Hello guys, welcome back to my YouTube channel. From this video, we will discuss about the asthma and the management of acute severe asthma. So what is asthma? Asthma is a chronic inflammatory disease of the airways which is characterized by reversible airway obstruction, airway hyperresponsiveness and airway inflammation. Asthma is a obstructive airway disease. In this picture, you can see the unaffected airway below and the asthmatic airway above. So you can see the normal or unaffected airway, there are relaxed smooth muscles. But in the asthmatic airway, the smooth muscles are tightened and the bronchial wall is inflamed and it is swollen. And also you can see extra mucus is present. Here also you can see in the first picture normal airway, then asthmatic airway and asthmatic airway during acute attack. So you can see how the relaxed smooth muscles get tightened during acute asthmatic attacks. So there are four main symptoms of asthma. Those are wheezing, coughing, chest tightness and shortness of breath. Wheezing means a whistling sound during breathing. Other than these, there can be several signs on examination: widespread wheeze, tachypnea, tachycardia, use of accessory muscles of respiration, reduced air entry, prolonged expiratory phase, as well as silent chest. Before going into management of acute asthma, we have to know the severity of asthma. That means whether it is mild or moderate, whether it is severe or life-threatening. So we have to check several parameters. The saturation level, respiratory rate is also mainstay of assessment of this severity. That means if respiratory rate is less than 30, that means it is mild or moderate. If it becomes severe if the respiratory rate is more than 30. And in a mild or moderate attacks, patient can talk in full sentences, but in acute severe asthma, patient cannot complete a sentence. And in life-threatening asthma, patient is actually there is altered level of consciousness, agitation or confusion, cyanosis, exhaustion, and also there is a silent chest. That means we cannot hear air entry. But in mild or moderate or severe asthma, the wheezing sign can be heard via the stethoscope. In the management of acute severe asthma, we have to go through ABCD approach. So first check for airway patency, then check for breathing by checking saturation, then respiratory rate and accessory muscle usage. If the saturation level is below 92%, give oxygen via face mask in rate 15 liters per minute. Then start oxygen-driven nebulization with 5 mg of salbutamol. Then add diprotropium bromide 0.5 mg to the nebulizer as well. If not response, we can do back-to-back nebulization or we can nebulize every 20 minutes. Here salbutamol is short-acting beta agonist. Ipratropium bromide is short-acting muscarinic antagonist. At the same time, you can give IV hydrocortisone 100 mg or oral prednisolone for 40 to 50 mg as corticosteroids. There is no difference between IV hydrocortisone or oral prednisolone. If patient can take orally, you can give oral prednisolone instead of IV hydrocortisone. This corticosteroid drugs helps to reduce inflammation and prevent relapses. If the patient has poor response, you can give IV magnesium sulfate 1 to 1.2 grams to 2 grams IV over 20 minutes. If the patient is not responding to IV magnesium sulfate as well, if deteriorating or if there is impending respiratory arrest, call for ICU and consider intubation and mechanical ventilation. That is the final step. So, as a summary, the management of acute severe asthma, first you have to give oxygen driven nebulization with salbutamol 5 milligram and add ipratropium bromide 0.5 milligram to the nebulizer as well. You can do back to back nebulization or nebulization in every 20 minutes for 1 hour. And also you can give IV hydrocortisone 100 milligram or oral prednisolone 40 to 50 milligrams as well. If not responding, IV magsulfate 1.2 gram to 2 gram IV over 20 minutes can be given. If there is no response or the patient is deteriorating or impending respiratory arrest, call for ICU immediately and consider intubation and mechanical ventilation. So that's all about asthma and the management of acute severe asthma. Hope you guys clearly understood about the management of acute severe asthma. Thank you for watching.